This month is Better Hearing and Speech Month, a time to raise awareness about challenges that affect hearing and speech and empower those who think that there might be a problem to take action. Here are some red flags if you're putting yourself to the hearing test. Frequently asking people to repeat themselves, having to turn an ear in the direction of sound in order to hear it better, having to look directly at the person speaking to you in order to understand them, being unable to hear all parts of a group conversation, experiencing pain or ringing in the ears, listening to the TV or radio at volume levels higher than other people normally listen. If any of these signs are displayed, a person can take action by visiting an audiologist for a hearing test. Most importantly, the diagnostic testing and hearing aid technology is constantly evolving, with the idea of helping those most in need for hearing treatment. Paige Holt of Lake ENT's Audiology team explains how they determine the best method to treat their patients.
Hearing aid technology is constantly evolving. We went from analog hearing aids 15 years ago to programmable hearing aids, meaning that we could now connect them to a computer, change the hearing aid to compensate for a decrease in hearing, to digital hearing aids, and then to digital hearing aids that had noise reduction. And then currently, what they're working on are different strategies and technologies to see how can we best enhance speech for the individual. We know that there are certain regions of the hearing nerve that are damaged and really hard for us to stimulate those higher frequency regions of the hearing nerve. So we have hearing aids that can transpose some of those pitches to stimulate healthier regions of the hearing nerve. So what they're working on are different strategies and processes where they can enhance the speech signal. The primary service that we offer with our clinic, Lake Ear, Nose, and Throat, would be diagnostic hearing evaluations for the physicians and fitting hearing aids. We see patients every day, all day long, on the spot as the physicians are evaluating medical conditions. Someone will come in and say, my ear is plugged up, I have ringing in my ears, I'm congested, and the doctors cannot always see exactly what's going on in the hearing nerve. So they'll send them down the hallway where we will do a diagnostic hearing evaluation and help them determine if something can be treated medically. If it cannot be treated medically, if it appears to be more of a permanent degeneration of the hearing nerve, then we will take over in our audiology department and begin to counsel them and recommend hearing aids. We see many patients upon referral of the physician, and we see many patients who just come in on their own. Probably a large percentage of our client base is from a referral of other patients that are happy with our services. So we get phone calls and people can come in for just a hearing evaluation. Once they come in for their hearing evaluation, if we determine that there is a medical condition involved, then we will recommend that they see the physician for further evaluation before we proceed with any recommendations on hearing aids. However, if we do not detect that there's any problems medically, then we will go ahead and proceed with hearing aids. It's very rewarding to have a phone call or have someone come in and say, I'm hearing things I never heard before. And that's very rewarding.
For more information on this story, as well as links to the audiology specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Evolving Solutions story link on our homepage at yourhometownhealth.com.